Most experts agree we're not done with the pandemic quite yet, but there's reason to believe there's a light at the end of the tunnel thanks to a vaccine. Either way, healthcare workers have had to deal with the very darkest the virus has had to offer. We found one Wabash Valley nurse who's been on the front lines battling. She was kind enough to take time to document some of her toughest days working in the ICU during the pandemic, and we discovered there's much more to her story.
Good morning. It's 5:23 in the morning. I'm getting ready to head to work. I usually use my time driving to work in the morning to just kind of chill a little bit and pray and hope for a good day.
Spend 3 decades working at any hospital and you're bound to have good days and bad.
I've lived here in this community my entire life. We're kind of in the middle of the nowhere, as you've seen, driving down here, so we are essential.
But when you take care of the sick in the middle of a pandemic,
I can't ever remember not wanting to be a nurse. I always wanted to be a nurse.
finding those good days is no easy task. Thankfully, Susan O'Neill is a professional.
I'm a registered nurse.
She's doing her best here at Greene County General Hospital to make those days better for patients.
I'm kind of a pesky nurse, I guess. I've actually had patients ask me to please leave them alone because I want to talk to them and be in their room with them a lot.
27 years, she's been treating all types of illnesses. Ups and downs throughout them all, but nothing's been comparable to her last 12 months.
Hi, it's me again. I'm getting ready to eat my lunch. It's 2:20. We've had a busy day here at Greene County, lots of surgeries, and I've been in the emergency room and third floor and ICU. I'm waiting on an ambulance to get here to transfer a patient to the heart center.
O'Neill works in the ICU. That means she deals with COVID patients when they're at their worst, dressing in full gear, keeping the danger out, even as the emotions flood in.
Most of the patients we've had down here were on ventilators at first. We transitioned from that. They found that that really wasn't the thing to do so much as to, I'm getting teary, to put them on, like heated high flow oxygen.
Many times those good days turned into great days when everything went well and patients could go home recovered.
We line up in the hall and we cheer and sing and clap and have signs, and it's been really inspirational.
They call them joy celebrations, rare reasons to smile, and the fuel O'Neill needed to stay afloat because, well, not every day has been joyful.
Just checking in, heading out for the night, 6:20 I think in the evening. It's been kind of a rough day. We lost a patient, which is always sad, but the hardest part of it was that we had some family members pretty upset because they couldn't go in and say goodbye. Really hard telling a grandson that he couldn't go tell his grandmother goodbye right before she died. Hopefully this all ends someday.
Another life gone during the pandemic, and because of restrictions, she has to be the bridge for the grieving. It's something she's done more than once.
Very, very heart-wrenching. One of my favorite patients through all this we lost. I took care of him on a Friday, and he seemed to be doing lots better. I found out on Monday morning he died, and that was really hard.
Difficult days here at her job. It's something she and 4 million other nurses around the nation are going through every day. Sometimes the frustration boils over.
Good morning. It's 5:24 in the morning. I didn't want to get up this morning at all. I kind of had a rough time going to sleep last night.
The pain becomes personal. At the recording of this video, O'Neill found out a family member contracted the virus, and a friend with the virus had taken a turn for the worst.
We found out he had to be resuscitated yesterday morning with CPR and put on a ventilator, and he's not doing very well, so.
She herself has been vaccinated, though it's not enough to make her immune from the worry and the pain of sick loved ones.
I'm just kind of really angry at the virus right now. I'm just so over it, and so is everybody else, I know, but it's causes so much heartache for everybody.
But every dark night turns into a new day, and the days seem to be getting better. Case numbers are going down, and O'Neill's ICU is seeing fewer COVID-19 patients. And as those numbers fall, the public is saying thanks.
I've had people make me shirts that our Farm Bureau agent in Bloomfield, Joe Medina, he made me a shirt that said that I'm essential. I think it said freaking essential or something like that.
2 words to describe what she does and who she is. Simply put, she's a nurse.
You know, you're worn out. There are times that on the way home your legs ache so bad that you don't think you can push the gas pedals. Nurses have to give it all. Their heart, their mind. You have to be pretty smart to be able to do this.
Your worst day is her business. And again, thankfully, like so many other nurses, she's a pro. In Greene County with photojournalist Jaron West, Rondrell Moore, News 10.